introduction. He's actually a pioneer in functional medicine. He's a legend in functional medicine. I'm talking about Dr. Alok Chopra, sir. His topic for today is Principles, Biochemistry, and Mechanisms of Diabetes Reversal. Dr. Chopra, sir's journey from being an invasive cardiologist to wellness practitioner to practicing functional, bioregulatory, and restorative medicine has been an interesting one. He established the Aashlok Hospital in New Delhi in early 1980s, the first of its multi-specialty, medium-sized boutique hospital, which is running tremendously well till date. In 2018, he established Daivam Wellness, the first comprehensive functional medicine center covering understanding and coming to a root causes of chronic modalities and treating the same. Dr. Alok Chopra has been constantly involved in integration of new concepts into his practice to improve clinical outcomes for his patients. He has decades of experience in interventional cardiology and currently is using functional medicine methodologies to reverse chronic heart conditions and prevent them. Let us hear from the doctor who knows the connection of diabetes and cardiovascular health through his lens of integrative approach. Over to you, sir.
Thank you. Thank you so much. Can I just hold it here? Just putting the screen. Okay, can everybody hear me?
Yes, sir, we can hear you.
Okay, so let's start. Okay. Okay, so let's start. I'm showing this because, I'm trying to tell everyone that diabetes is 100% reversal, and conventional medicine, big pharma, and the way we have been taught and the way we've been brought up is something like this. They keep looking at everything, look at every aspect of your body, and then they say, we find nothing wrong with you. So funny enough, they said, we're going to treat you for a symptom deficit disorder. Then they say, we have found a drug for it, but the drug has a side effect, but we found a drug for that as well. That's how it goes. And if you keep following big pharma, this is what you will look like, or maybe even like this. Or you may finish before you even start. So don't feel disheartened because we have the answers to all. Here is a person who was the editor of the New England Journal of Medicine and who has really said that she does not believe in all these stories that all the journals have told, and everybody is against it now. We follow this way of reducing or reversing heart disease, and we found that 95% of people completely reversed it. Blood glucose improvement happened, medicine reduction happened, weight loss, and every other disease just went away. Diabetes is spilling out of control. 53 crores in the world, 10 crores in Southeast Asia, India is 7.7 crores, and so many people are dying daily because of diabetes, and it's not a disease, it's a dietetic illness. Now, diabetes is not just diabetes. We call it the cardiometabolic syndrome. And I have no doubt that we are talking about diabetes today, but with it comes all these other illnesses which become part and parcel of it. So the idea of showing this disease, this slide, is that when you have diabetes, you are open to all the other ones, and one may trump the other. So we have to keep our minds open, and it's not just the diabetes itself. Now, what we see is high blood pressure, but what we look underneath is, look at all that: sexual dysfunction, depression, erectile dysfunction, foot ulcers, fatigue. All these symptoms come up, and we never realize what we're going to see. What we see and what is reality is very different. And this is the way we started. We look at it as a pyramid where the base of the pyramid is our structural integrity, all our massage, physical therapy, exercise, muscles, bones, and joints. Then there's the biochemistry, what we eat, drink, consume, the air we breathe. And it's not just what we eat, it's also what we digest, what we absorb, what we assimilate, and what we eliminate. Then we have the mindset, whatever the mental inputs that we are putting in our body, and also the electromagnetic forces and the 5Gs which are bothering us. So it's not just the, nutrition is of course the driver of this diabetes reversal, but we often do not look at the other aspect, and then we end up having, sitting on a four-legged stool with three legs. Now, the most important part of the diabetes reversal is the basic situation which controls it. Now, I'm not going to spend too much time on the details of nutrition, but it is critically important to understand the biochemistry and how this all functions. See, our DNA is 20,000 years old. My God, 20,000 years old. So with it comes an unchangeable property of increasing fat storage and decreasing fat burning, and we cannot change that. And believe it or not, this is one of the main actions of insulin, which nobody knew. Now, this property is bigger than the fact that insulin uses the carbs for energies and prevents people from becoming diabetic. And this is the basic paradox, that the property of storing fat and reduced fat burning trumps the other property. So if we see what our ancestors did, they got up in the morning, they did strenuous morning ritual to run away from animals or to look for food, doing some weight activity, some sprint-like activity, and multiple times, most importantly, multiple times short bursts of aerobic activity. Now, what I want to tell you here is that this, the recommendation of walking 10,000 steps and doing long cardios and long, walking is, of course, it's not a bad thing, but ultimately it doesn't help because it's not in our DNA. Please understand that. So you need to do a high intensity interval training, some strength training, and multiple times, small episodes of multiple times of, doing activity. So do not waste your time doing that. You will lose weight on the scale, but what you are losing is muscle mass and bone mass, very much like the long-term marathon runners who ultimately, succumb to every illness. Second lesson is that, they did a lot. They worked up a great appetite and they had wanted to have a big meal. And this translates to the fact that our first meal is our biggest meal. Then the whole day they worked, they kept on working from morning to evening. And, there was no electricity at that time. So before the sun sets, you must eat your last meal. Now, we can translate that to keeping at least 3 to 4 hours between your last meal and sleep. The next lesson is that, the last meal is the smallest meal. And the last lesson here is that there are only 2 meals because of the paucity of availability of food. And it's not just a fad name called intermittent fasting. I've never used this word intermittent fasting because it's not a fad, which has, become literally. What we really need to know is that it was not possible to eat more than twice, and very often it used to be only once because food was scarce, and therefore at least once a week or twice in 10 days we should do a 24-hour fast. Now, the other thing that we have to honor is, apart from our ancestral past, is our body clock. Now, we all knew there was a body clock, the circadian rhythm, but a lot of excellent work by Sachin Panda told us that every system in our body, every mechanism in our body, every microbe, every system, everything has got a peak performance time and a peak resting time. So if you are doing the others, obviously it's not going to go out. So it wants you to wake up around 5:30, a 10-minute aerobic activity, 20-minute exposure to the sun to switch off your melatonin and start the other, metabolic hormones. Peak decision-making time is 12 noon. 2:30 is your nap time, allow 30 to 45 minutes. And if you include some binaural beats, which you can get, on the net, on your ears, and you will get a very nice theta rhythm sleep, which will give you, a sleep which will rejuvenate you, more decision-making things, and, your whole element will become different. Finally, 4:35 is the strength training time. And now I've been hearing that a lot of people are getting into this, that strength building time at this time, although it doesn't, may not suit everybody. Anyway, 7 p.m. should be your last meal. And because fat burning switches off at that time, there's no point eating after that. 10 p.m. sleep, wake 5:30 again. So you got a good 7.5 hours sleep. So these 2 points are the most important situations. Honor your ancestral past and superimpose your body clock over it. We do not use the usual, systems that we have in our body. Our systems are based not on respiratory system, this system or that system, but it is nutrition, the gut microbiome, hormonal balance, inflammation, immunity balance, metabolic balance, mitochondrial detoxification, structural integrity, psychospiritual integrity, and epigenetics. These are the systems on which we lay bare everybody. What I'm trying to repeatedly tell that I know nutrition is number one, but please do not ignore the other things. They are as important. You can have the best nutrition, but without that, it won't serve you well. Now, here is a very crucial moment that we are trying to talk, is that, before we are always told by, whoever taught us early, that you must have at least 3 main meals: a starter meal, a snack meal between breakfast and lunch, 1 or 2 snacks between lunch and dinner, and a bedtime snack. Now, they were eating many times a day. Now, what is happening here is that what we discovered, as we told you before, that the insulin is responsible for storing fat and reduce fat burning, in spite of the fact that it protects us from becoming diabetic. But the point is that the property of storing fat and reduce fat burning is more important. So here is the paradox, that insulin protects us from becoming diabetic, but at the same level, each time we eat, it stores fat. So rather than doing 3 meals and multiple meals in between, we should reduce our meal times. What it means is that we are keeping an insulin dominant lifestyle, and as a result, we are storing fat. And in spite of all the other normal recommendations made earlier, this is going to be the real problem of our lives. Now, when we eat, the sugar goes and is stored in the liver and the muscles as glycogen. Some is utilized for energy, and the other 30 to 40% is stored as fat. So in the initial first phase of eating, 3 or 4 hours, it is the glucose which you have eaten, or which is coming up from the muscles and from the liver is taken up. After that, a stage comes around 8 to 12 hours that the fat burning starts. But we never give our body a chance. We're eating so often, and we're eating mostly carbohydrates, so fat never gets a chance to burn. So it keeps getting stored, and it starts making all your organs surrounding by the fat, which is called visceral fat. First your liver, then your pancreas, your eyes, your kidneys, your blood vessels, everything gets surrounded by fat. And before you actually look fat, the fat has already surrounded all your organs, and you are all ready to become a diabetic. So when someone becomes a diabetic, the scene has already been set. Many times I tell people, you are diabetic. They said, no, we are pre-diabetic, or even pre-diabetic. And I make a joke with them and I say, pre-diabetic is like saying that I'm slightly pregnant. You can't do that. So you are all in a diabetic state for many decades before you get overt diabetes. So please understand that this is a good time to attack this when you are in this state, because that will be easier to handle rather than ending up doing insulin. Insulin, by the way, is not my favorite. There are situations like type 1 diabetes or type 2 diabetics who get converted into 1.5 diabetics, and or people who are very frail. But apart from that, I still consider insulin as some form of a poison, which is not a great idea, because I'll explain in a bit. Now, when you look at this diagram, this is the main important diagram that I want to talk about. See, when you eat a carbohydrate, the sugar goes the highest as compared to protein and fat, yes? And the higher the sugar goes, the higher the insulin response. So the insulin response from a carbohydrate is high enough, the protein is about half, and funnily enough, contrary to popular belief, there is hardly any rise of insulin when you eat a fat. So when you eat a fat, there is no rise of sugar. When there is no rise of sugar, there is no rise of insulin. When there is no rise of insulin, there is no message in the body to store fat. So this comes as a big misnomer to everybody. Everybody gets shocked when I tell them this, but that is the real truth. And we are talking about the good fats, and we're not talking about the junk fats that are available in the market. And this is the way it happens. So the fat is like, so it becomes very difficult to relieve the fat. Fat is like something hidden in your deep freezer, whereas, the glucose is like opening your fridge and taking something out and, giving it away. So the people who have become fat by eating so-called fat are actually eating sugary fat. They're eating cakes and pastries and ice creams and jalebis and all that. And, the bad name is going to the fats, and actually the job is being done by the carbs. So then when you become diabetic, your doctor says, hey, you've been starved of carbohydrates. Now, does this look like starvation? Yeah, to the doctors it may be, but it doesn't look like starvation to me. So, we are not, they say that you have been stored very, full of, what am I saying? the starvation of carbohydrates, and therefore we must eat more carbohydrates and keep eating them more often, because your metabolism will run faster and the carbohydrate energy dissipates very quickly. So again, this is a whole plan to make you continue to make you diabetic. So a stage comes when we actually have a proportionate amount of insulin for a proportionate amount of sugar. But if you keep on eating carbs and keep on eating sugary foods, you will need more and more insulin to control the same amount of sugar, till a time comes when the body stops responding to insulin, and that is called insulin resistance, and you finally become diabetic. It takes a few decades to do that, but it ultimately, you run out of insulin. You don't really burn off your insulin making cells, but you can rejuvenate them in most cases. So this is how, just a diagram of how literally, how a fatty liver is created. And everybody says, it's a key to that fits a lock. Now, everybody, a lot of the people who are even doing diabetes reversal say that there is a key, which is insulin, and the lock, which is gummed up. There is no such thing. It is a overflow mechanism. The glass is always full. You keep putting in carbs, and there is no place for the cell to add more carbohydrates. So the cell becomes big and big and bursts. When it bursts, all the inflammatory fat surrounds your crucial organs. And that's what it is. A typical example is like this. Your bag is going to break. The cell bursts, the inflammatory fat goes all over, and every time you do that, you're adding and adding to your disease. It's an overflow phenomena, not a key and look. Similarly, you must have seen these pictures before in Japan, where they're pushing the people into the train, and it makes the same thing. So here, what are the defining characteristics of a well-formulated high-fat diet? So first of all, the diet is 70% fat, 20% protein, 10% carbs, which is a high-fat, moderate to low carbohydrate diet. One usually needs to keep the carbs less than 50 to 55 grams a day. That's about 100 grams of protein. Again, it should provide enough macronutrients to preserve good muscle mass and functional body. Effective protein intake is 1.2 to 2 grams, depending upon the body weight. And this is, we have a calculation which we can tell if in some other time, 250 to 200 grams of fat. Now, majority of daily energy taken in this thing comes from healthy dietary fat, mostly from monosaturated and saturated fats, which were earlier, considered cause for heart disease and the villains. But that is the basic only macronutrient which is really helping. Counting or restricting calories is not necessary, literally, because supposing I say that you have to have 1,000 calories in a day, and you take 1,000 calories of candy, or 1,000 calories of beef, or 1,000 calories of ghee, the response of the body is completely different. So obviously, please do not count calories. What we do have to count is the number of grams of carbs that we are eating. This is just a little pictorial picture of vegetarian and non-vegetarian thing. So in a nutshell, what is our nutrition? A diet rich in good fats, moderate proteins, low in carbs, no processed foods, lots of multicolored vegetables, lots of fermented foods, nuts, seeds, less or no dairy, reduced or low fructose fruits, no gluten, delectinized grains, beans and legumes. Now, one size doesn't fit all, but roughly speaking, in a nutshell, this is our diet. Now, this is a very old thing which I managed to get from the FDA annals. This is what was first given as the guidelines for eating. Just have a look. Foods which are strictly forbidden: sugars, flour, bread, biscuits, rice, sago, barley, oatmeal, beetroots, onions, honey, sweet wines, liquors, syrups, look at that. This is not allowed. And what is allowed and what is good for you is butter, olive oil, cream, all the cheeses, the bacons, the ham, the pork. Look at this. This was written in black and white. It's looking yellow today, but it's looking black and white. That this is our real diet. And the big pharma and the whole thing have completely hijacked it. This was never released in the market. And this is, where the whole problem started from. So it's not what you eat, it's when you eat. And the mantra is don't eat less, eat to full satisfaction, don't overeat, eat less often, and mostly plants, right? And that is how the whole fasting mechanism also started. A typical plate of a well-formulated high-fat diet, 60% is seasonal vegetables, meat and meat alternatives, 10%, healthy fats 10%, low fructose fruit 10%, and fermented food, vegetable. This is what our real diet should look like, and look at it, how attractive it looks, even in a picture form. This is just a sample thing that when we start the diabetes program, we put a continuous glucose monitoring device on a person's arm. And as you can see on your left, that the yellow part is showing how the sugar is spiking. And as we convert it within days, even when people are on insulin, on the fourth, fifth day, the sugar starts to coming down and even getting into a hypoglycemic type of situation. And this is also very useful, because once we bring the sugar down, we keep the CGM, the continuous glucose monitoring, on, because we tell people to experiment on what is causing high sugar, what is not causing high sugar, because our gut microbiome actually causes a lot of changes in the absorption of food. So there's no one size fit all to everybody. So another few weeks are spent in testing what suits you and what doesn't suit you. By the end of 3 months or so, starting from 6 weeks, most people have reversed the diabetes. The next 3 months up to 6 months is maintaining it. So, even people with insulin, we have managed to take it off within 2 to 3 weeks, which is so heartening. Now, what happens when, in spite of doing everything right, it doesn't get better? So if you're not eating good fats and not eating good oils, this is the biggest one, because people cannot get it down the system that how are we eating so much of fat? But remember, when you eat a high fat, do not combine it with high carbs, because it will not serve the purpose, and you will, and they'll blame us for saying that we ate so much fat. So do not eat high carbs with it. You can eat, all the leafy green vegetables, your sea vegetables, the cruciferous vegetables, and the other nuts and seeds. That's the good time to have the good fats as well. Dairy, again, nothing like bad dairy. Dairy is literally like poison, but you can compensate for dairy a little bit by having some hunk curd or Greek yogurt, or hard cheese. Over-the-counter prescription drugs. Thyroid issues, one of the main big features which does not allow the diabetes to get better. And despite the small little gland, people are not looking at it carefully. We have a special apparatus called the Thyroflex, which hardly any doctor knows how we work on how bad or good the thyroid is. It also covers your neurotransmitters, it covers your melatonin, it covers all the metabolic functions of our body. And it's very essential that we do this test in a different way. Most people are only doing TSH. All the doctors are only writing TSH. I can't understand why they are not mentioning that. And T4 is not a real hormone which converts it. It's relatively inert when we are treating thyroid disease. It's the T3 which is important, and T4 has to be converted into T3 and other T1, T9s, which will happen. So please make sure that your thyroid is properly done, including reaching your antibodies. So reduce the carbs, lack of sleep, adrenal function. Now, adrenal function is also when you are so stressed out and so much tension, you run out of your adrenaline, of your cortisone, and as a result, you get adrenal fatigue. And without that, your diabetes will never get better. Insulin resistance can be sometimes very severe due to certain illnesses or a very long-term, bad diet, or even when you are taking a lot of extraneous insulin. Heavy metals and toxins, also a very, very big way that can destroy your. Now, another common mistakes, even on a low-carb keto diet, common mistakes are made that they eat processed meats, bacon, cheese, beef, factory-farmed animals, artificial sweeteners, more focus on macronutrients and not on food quality, avoiding vegetables for fear of carbohydrate grain, that's very funny. Eating pasta, beans, vegan, sweets, bread, ketchup, juices, desserts, cereals, candy, yogurt, agave, fruits, sauces, dressings, all in the name of living green, and that is how people say, make these little mistakes. Now comes the real big daddy, which is the time-restricted fasting, or intermittent fasting, as people call it. I don't like this word. I've never used this word. I don't like this word of keto diet. We call it the mitochondrial metabolic therapy. The fact that I'm changing these names is not changing what is done, but because this intermittent fasting, reminds me of a fad. Everybody is using it. Nobody is concerned about what they're eating, when they're eating, and all that, in the name of intermittent fasting. And they're eating junk food, and it doesn't work, and the name goes bad. Got stuck. Excuse me. Okay. Okay, now here's the correct term. 16-8 is the ideal form of fasting. That means you need to have a 16-hour fasting window and 8-hour non-fasting window. This can be changed to about a 10-hour and 14. And sometimes in the beginning, when people are not ready to do it, even a little bit longer, like a 12-12. But the ideal form is 8 hours fasting window, 16 hours non-fasting. First meal should be 60%, last meal 30 to 40%. And taking care of your body clock, the best is, I'm written 11 a.m. and 7 p.m. because it's more practical. But the ideal way of doing it is either 9-5 or 10-6. And a lot of people who have found their ways from working at home, which is another boon that, COVID did to people, that they started eating early. People who are eating at 9-5 or 10-6 are really flourishing, which is great. Some people may need an optional small snack because sometimes you do feel hungry, but that snack should be nutritionally dense and very small and should not be anything that will raise your carbs. Black tea, black coffee, green coffee, matcha tea, nimbu pani, dhania pani, methi pani, all that is done. Fruit should never be eaten on an empty stomach and must be preceded by some protein. Now that we are on the subject of fruits, I'll keep talking about some aspects of nutrition, because I want to talk about fructose. There are two types of fructose in the body. One is the industrial fructose, which is found in anything which is packaged, processed, pesticides, preserved, or carried in plastics or transported. And that is really bad fructose. It's poison. Do not even touch it. Seed oils also come into this category. Please, any oil which is liquid at room temperature, with the exception of olive oil, hemp oil, and avocado oil, deserve the waste paper basket. And the good oils that you have to take are ghee or white butter from grass-fed A2 cows, extra virgin cold-pressed coconut oil, and extra virgin cold-pressed mustard oil, or even sesame oil, where you can get straight from the source where it is not heated. It's the cold press which is the important part. Now, fruit sugar, unfortunately, is 100% fructose. Now, I'm not demonizing fruits, but I'm not raising it to the holy grail of health that our Indian brothers have made it to be. It's not right. Fructose is still fructose. So therefore, when we are reversing diabetes for about 6 weeks, we do not give any fruit. And then slowly we add on the low fructose fruits like grapefruit and tangerine and kiwis, berries across the board, cherries, not grapes, apricots, guava, cantaloupe, and green apple. These are your low fructose fruits, which will slowly be introduced into your diet regime. So please do not look at fruit as the big daddy of it. It isn't. Secondly, again, we all remember that our great-grandfathers and grandfathers and fathers used to give us fruits immediately after a meal so that it goes into the circulation and into the metabolism, because fructose is not metabolizable. Please understand, only glucose is metabolizable, fructose is not metabolizable, and that is why when you eat fructose, your sugar does not go up, and people think that because sugar is not going up, fruit is the big hero. It's not true at all. We have to reduce the eating of fruit. We have to start with low fructose fruits, and we should never drink fruit juice and never have food on an empty stomach, regardless of anything anybody says. So this is the importance of fasting. I will not agree with anyone who says, even now, a lot of people who are practicing diabetes reversal to eat 5 times a day or 6 times a day is clearly out of the window. This thing, our DNA doesn't allow it. And ultimately, even if you lose weight, you will be losing muscle mass and bones, and it's not the right way to do it. Excuse me, stuck again.
Should I open and share my screen?
This is a very quick thing. I'm going to skim through a lot of this because, unfortunately, I would need something like 1.5 to 2 hours for this presentation. This is just something that what you can have when you're fasting and what you can't, and what are really no-nos. Okay, maybe you can try next slide.
Okay, I'll just.
Yeah, this is the benefits of fasting. One is ketosis. Now, ketosis is a great thing because it will you're utilizing ketones, which are your basic fuel, and the fuel is used for fat. The fat is burning. Hormesis is a very wonderful word. Hormesis is something that when you do a small, if you use something which we can call a poison or a difficulty, like overworking and fasting, the body responds not to convert itself, but it really exceeds itself, which means if I eat 100 kilos of Karelas, I might just die. But the Karelas or the broccoli or these foods are actually a little bit kadwa, and that is why our body raises itself and exceeds it. So hormesis is a big secret. Autophagy means that there is the mitochondria. I'm just coming to the mitochondria later. Will actually eat up all the stuff which is not needed, and it recycles the system back and takes it away. It also causes the it's like running your car the whole day and then putting it in the garage with the ignition on. So autophagy is clearing up all the muck that is there, and that is why when we are sleeping and early and keeping a large window, we are allowing our body to rest, regenerate, and repair. Inflammation is a big thing, and ketones depend on that. Fat loss, neuroplasticity means that even at this age, we can make more neurons, extends a healthy lifespan. It removes all our visceral fat, increases in the growth hormone. Now, this is another thing. When you start coming into the fat burning zone, that means when in the initial phase, it is the glucose, then is the fat. When you come into the fat burning zone, growth hormone is secreted, and growth hormone protects your bones and your muscles to not let them burn. So there's a lot of people who say that if we fast like that, we will lose our muscle and bone. It's not true, because the growth hormone will protect you. Lowers insulin resistance, prevents all the diseases which are neurodegenerative or heart disease or cancer, and it improves our gut so that absorption and control get better. So it's really one of the best things that we can do. Fasting is the most powerful item that is the need for diabetes reversal. A study showing how fasting versus chronic calorie restriction, you see the difference is a vast, big difference. When you reduce calories, your body will feel that there is a famine. It will start storing fat. You will start losing less calories when you are running or walking. So ultimately, fasting is clearly trumping just a low calorie food.
So 5 minutes to go, sir.
Okay. So, okay, I'm going to skip that. This is just a quick thing of, a typical ketotarian diet, avocados, coconut creams, leafy vegetables, nuts and seeds, pasture-raised eggs. I want to talk about eggs. Eggs does not, first, let's understand that cholesterol is not the cause of heart disease. Cholesterol is not the cause of heart disease. I can keep repeating it. What does happen is that when you pan fry an egg, the yellow becomes a little oxidated or inflamed, and the white part is only 90% water and 10% junk protein. And so therefore, when you boil an egg, or hard boil or soft boil, or a raw egg smoothie, or or poached egg, that's the way to eat an egg. And I don't mind you eating 4 eggs a day even. Ketone benefits we have cleared. This we've also talked about. I think we can skip that, all the things. Metabolic flexibility, I'll just use a few lines to it. It's the ability of our body to adapt, to use any fuel that is possible. Being able to rely on kindling like sugar or firewood. After a recent meal, first, the kindling happens, and after that, the big log happens. So that's the fat, and the other one is the thing. So we must have a ability to use glucose when needed or fats when needed, and metabolic flexibility is crucial in diabetic reversals. And there are certain obstacles to that. I'm going to skip that. These are the causes of inflammation. Everybody says, what the hell is inflammation? Now, inflammation, everybody thinks a red hot burning thing. It's not that. It's this inflammation that I'm talking about is a slowly brewing asymptomatic inflammation, which is coming from the fire of your immune system. And you can see the long list of causes, which all of you are familiar with, flour, food allergens, low-grade inflammation, gut imbalance, toxins, stress, redundancy, all this is causing inflammation. And every aspect of it is reduced by fasting and eating the right stuff. This is mitochondria, your main energy givers. It takes oxygen from the air and calories from food and gives you energy. It causes autophagy, which eats up all the muck. It causes mitophagy, which kills, it covers up all the dead the mitochondria. It causes mitochondriogenesis, creates new mitochondria, and that's how the it's a too long a subject to discover now. But remember that our mitochondrial health is most important, because that's the only way we create energy. And one of the ways is again fasting and eating food which is low carb and high fat, so that more ketones are in the circulation. Benefits of 3 hours between eating, dinner, and sleep. Quite obvious. Helps mitochondrial functions, repair and detox. Brain's rhythm goes better. Gut repair is hampered. So definitely must 3 hours or 4 hours between. Okay, these are all lists we can talk about later. I'm keeping some room for the Q&A.
Thank you so much, sir, for your insightful session on diabetes. There's one question in the chat box. Is it absolutely possible to reverse diabetes type 2 only by efficiently taking the diet correctly?
I just said no. The answer is a big no. Yes, as I said again, that your nutrition is your driver, but without the other things and without so many other things that I mentioned, about 10 things, that you will not succeed when your thyroid is not better, if you're eating the wrong foods. A lot of people think that if they eat intermittent fasting, but if they're not eating right. So if you're not eating right, it's not going to help. So the slide that I showed on I'll just bring it back again. Yeah, see, this is the thing. So if you have these 10, 12 things, you can do what you like. You can fast the same thing, but if you don't take care of this, it's not going to help.
Gaurav is asking, my father is suffering from diabetes last 10 years. Also, blood pressure is high. Last month, he had a check of the blood test, and I guess he's mentioning the CEA values. That is 5.53 by 5, and his age is 60. Could you please suggest how to control the CEA values?
Oh, this is a little long discussion. I'd rather sit down with your father and do that. It's basically, CEA is a marker. It's a marker for inflammation. It's a marker for precancerous situations. So difficult to discuss the subject here. But what I'm trying to tell you is that doing what we ask you to do, or what I'm talking about, will definitely reverse it. Of course, there are situations which sometimes we can't control, but 90 to 95% of type 2 diabetics are 100% reversible, including all these inflammation markers.
Rest of the questions have been answered. If you have any further questions, if you wish to consult Dr. Alok Chopra, sir, information of the same has been sent on your WhatsApp groups and your Zoom chats. Thank you so much, sir, for being with us and sharing your wonderful insights. Thank you.